We're now venturing into maybe starting some supplements based on that blood work. You're now prioritizing some movement in your day. You're being mindful of what you're eating and consuming throughout the day. You're prioritizing sleep. That as a whole is such a beautiful place to start for those 6 months. Where I think we then need to venture into is the conversation of where do our partners come into play with this, and how does their health also impact our potential chances of getting pregnant? And my preference is I want to see you both at the same time. So rewind 6 months ago when we started working together. It's so important to me that both of you are present and sitting in for that visit, because your healths individually and collectively have a massive impact on our ability to get pregnant, stay pregnant, and again, create the healthy family that you've been dreaming of. And for whatever reason, unfortunately, in society, we are not giving men as much of a highlight and as much of a spotlight as we should be for their fertility. And of course, they're half of the equation. It takes two of us, an egg and a sperm, to create that baby. And it's so important that, again, they're part of the process early on. So for men in a similar fashion, I really want a good understanding of their hormonal health. So we're starting with a good blood test. Lucky for them, they don't have a menstrual cycle, so their pattern is more of a 24-hour rhythm. So the timing of that blood draw doesn't have to be as specific, generally just done first thing in the morning and fasted. We're looking at a variety of parameters, including their hormonal health, their metabolic health. One additional thing that I will always do for all of my male patients who are working to or trying to conceive is an additional test, and it's a semen analysis. It's important that we have a good outcome measurement that gives me a better understanding of how well their body's producing sperm, how healthy those sperm look. Are they swimming in the right direction? Are they swimming at all? What does their size and shape look like? We can get so much information from a semen analysis that we otherwise just can't see from just a blood draw. And so that is something separate that's so important that a male is doing. And again, the earlier, the better, because the more time that we have that information, the more time it gives us to just make a difference and do something about it. And again, we just don't know what we don't know. So that's a really important part of the process. Once we have that information in a similar way, I'm going to have really same and similar conversations with them so that we are prioritizing the foundations of health. Maybe we're starting a supplement routine. We're certainly going to base off conversations of any prescription medications off of that semen analysis and or off of that blood work collectively. And then I'm going to again put the ball in their court. We need to be prioritizing those foundations of health.